So what can the average person do to prevent infections? The first is hand hygiene. That's what you learned back in kindergarten. Use soap and water when washing your hands or an alcohol gel product. The next is the importance of respiratory hygiene and etiquette. Cover your cough. Don't cough out in the open, but use the Dracula move and cover into your sleeve. Third is the importance of immunizations. And finally, environmental cleanliness. For example, when you're in the market, make sure that you use the Sani-Cloth to clean the handle of your shopping cart.
The most effective thing you can do to prevent getting influenza is to get vaccinated. The vaccine needs to be given every year because it's formulated to match the strains that are circulating around the globe. And these change annually. This year, the recommendations for who should get vaccinated against influenza have changed. This year, the CDC recommends that everyone over the age of 6 months should get the annual flu vaccine. Another thing that's different is that the vaccine now contains the pandemic H1N1 strain, as well as other strains of influenza virus that are currently circulating. You only need to get 1 shot this year instead of 2. Here are a couple of tips for you in case you happen to get influenza this year. First of all, don't go to work. Don't expose your family, your friends, and your work colleagues. When your fever has gone away for at least 24 hours and you no longer need to take fever-reducing medication, then it's probably safe for you to return to work. In the meantime, if you still have a cough, it's best if you wear a mask. Now, when should you call your doctor? In most cases, a call to your physician is really not required. And for certain, your doctor probably doesn't want you to appear in the office when you're very symptomatic because you might expose other people in the office. On the other hand, if your symptoms get worse, your fever gets higher, you're having difficulty breathing, or other symptoms possibly of pneumonia, that certainly would warrant a call to your doctor and possibly beginning anti-influenza virus treatment. It's very important for older adults to try to prevent getting influenza, since we know that older adults are at a greater risk for the complications of influenza. As well, they don't respond quite as well to the vaccine as younger people do as a result of aging of their immune systems. And in addition to that, older adults often have other chronic underlying conditions that could put them at higher risk for complications such as pneumonia, which is often the most important complication of influenza and can be life-threatening. The most important thing that we can all do to prevent transmitting influenza to one another and to our patients is for everyone to get the vaccine this year.